Is it recorded? Bear with me. Right. Good morning. This is the third video staff meeting that we're going to do on the 24th of September. Just to say, I've already had apologies from Alison Harris and from Angela Rees. I will go around and introduce, ask everybody to introduce themselves from who I can see on the screen. So the first top left person I can see is Sarah. So if you want to go and everybody introduce themselves.
Sarah Bailey, Care Coordinator of the Ceredigion team.
And the next person on my screen is Joe.
Jo Silverthorne, I'm Service Development Manager with Carers Trust Crossroads.
And Kelly.
Kelly Thomas, Care Coordinator in Carmarthen.
And middle left is Julie Duran.
Julie Doran, Leslie, Care Coordinator.
And in the middle is Nicola. And far left is, we have three members of staff from the Carmarthen office, if you'd like to all introduce yourselves.
Lynn Mathias, Care Manager, Carmarthen office.
Sue Huff, Care Coordinator for Carmarthen.
Mary West, Care Coordinator for Carmarthen.
Bottom left, Leanne.
Leanne Lewis, Carmarthen office.
Yeah, we'll come on to Leanne in the meeting.
Yeah.
Julie Davis.
Julie Davis, Care Manager for Leslie.
And last but not least, Erica.
Erica Watts, Finance Manager in Carmarthen. Hang on with it.
The reason why I'm asking everybody to introduce yourselves is because this is being recorded and perhaps external agencies might be watching it, perhaps CIW, for everybody to introduce themselves as to what their positions are in the organisation, and any new members of staff who might start, they could also watch the video as well. So hence why I'm asking everybody to introduce themselves, just to sort of make it sort of clear. As I've said, apologies from Alison Harris and Angela Rees. Everybody should have had the agenda sent to them via the WhatsApp. It has had an additional 2 items put on since the last time it was sent out. And if anybody's got any queries within the meeting, please, now's a good time. I am aware that Joe has to leave the meeting halfway through, so we'll try to cover what Joe needs to highlight before she leaves to go to another meeting. First on the agenda is CIW inspection of Crossroads Services. Just to say that we have a new inspector, Stefan Hughes. He'll be undertaking meetings with myself every 6 weeks, as opposed to our normal inspections, which is late. He'll be doing a face-to-face meeting, is not going to happen due to COVID. He will be doing Microsoft Teams video link, where he'll be asking me a series of questions through the regulations and asking me to evidence and document what we do as an organisation. The first meeting was on the 8th of September, and the next meeting is due on the 21st of October. So I will be meeting with him and going through all the things we need to cover. So hopefully the feedback will be positive. I don't know at the moment, it's something I need to ask him as to how he's going to do the report, if it's every 6 weeks. We might have a report after 6 months, or it might be after the year, depends on where we are with regards face-to-face meetings as well. So at the moment, it's going to be slightly different. From what I can gather, some organisations are having it monthly, but we, Crossroads, are going to have it every 6 weeks. The next thing on the agenda is Trusted Charity Mark, which Joe wished to highlight within this meeting.
Yeah, thank you, Karen. So the Trusted Charity Mark is a quality assurance system that we've recently signed up for. So for people that have been with Crossroads for a number of years, you might be familiar with the quality mark Croquet, which was then replaced by the Carers Trust quality mark. Carers Trust no longer use that as quality assurance, so we're now having to work towards what's called the Trusted Charity Mark. And the purpose of working towards that is to ensure that the organisation is fully compliant with the law, with charity law, and also to make sure that we are conducting ourselves as an organisation as openly and transparently as we can be, because obviously as a charity we're in receipt of public money, which therefore makes us accountable. So we're shortly going to be pulling together some working groups which we will open up to all staff, and the working groups will focus on 11 areas of the quality mark, ranging from planning, leadership and management to user-centred services and managing people. So what we're going to be doing shortly is sending further information out to all staff. I've been tasked with taking the lead for the organisation on working through this, and we are hoping to be able to achieve this by the end of March 2021. So there's quite a bit of work to do, and the reason why I'm having to leave this meeting is that I've got another Trusted Charity webinar to attend. So we are going to be going through things with a fine-tooth comb and trying to involve as many staff as possible. So I think it's a really positive thing because it will make sure that we're running things properly. And like I said, we'll send further information out to all staff at a later date.
Thank you, Jo. The next, is anybody got any queries with that within the people in the meeting? No? But the sounds of it, we're all going to be involved at some point in providing information. But this, from my gather of the Trusted Quality Mark, is that it's a bit like a very extensive NVQ or QCF where you have to evidence and document the work we're doing to be able to get that mark. Yeah?
Yeah.
Okay. The other next thing on the agenda is in regards the Carer Resilience Project. So I don't know whether it would be worth Kelly giving an overview as well as where she sits within the Resilience Project, and then Jo. So I don't know whether you want to start, Kelly, with saying a little bit about the work you're doing and then pass over to Jo.
Yeah, okay.
To see where we are. Is that okay?
Yeah, thank you, Karen. The Carers Resilience Project has been up and running now since July. It's referrals from social services. It can be internal referrals. People who used to go to day centre or respite services, and due to COVID, we're no longer getting that support. The project has gone well. At the beginning, we were quite busy. It has slowed down a little bit lately, but I don't know if Jo agrees, but I do envisage with developments happening now that it's going to start picking up again. But we have been able to put emergency days and nights in to support carers who are at crisis point or who are just generally struggling and not being able to get a break.
Yeah, and I think it's kind of gone quiet sort of in September because I think people are still a little bit nervous and anxious with all the developments, you know, the restrictions, we're not quite sure, and I think perhaps social workers are getting pulled into other work. And I think because we're heading into autumn, winter now, I think the chances of the day services reopening are slim. And if we're going to go through another wave of coronavirus, then I think, you know, possibly as restrictions tighten as well, we're going to see more people that are going to need support, because obviously there's an awful lot of people that have been without support for over 6 months now. And the purpose of this project is to actually prevent things from escalating to a point where, you know, somebody is at risk, at serious risk. So whether that's the individual or whether that's the carer, we know how difficult it is looking after a relative or friend, even for those that have got regular support. So for those that have gone 6 months without anything, you know, the purpose of this is for us to offer, you know, we'll come in and we'll support you as much as we can. So
yeah, and a few of them, sorry, I was going to say a few of them as well have actually come on as permanent packages with Crossroads as well. Yeah. So it's a way of getting that early intervention, and then with some of them, then we're able to follow it through then to provide sort of long-term support as well.
So has it moved more into Crossroads support as opposed to CIW, Carers Information Service and information based? Is it more for the support that
it's been both, to be honest with you, because I've been following it through from beginning to end. it's carers information support, outreach support, and then additional support then, which I pass on to carers information, and then I provide the deal with the replacement care and the overnight. So it's both, to be honest with you. It's a holistic sort of approach for everything.
Yeah.
And I think that's good for the organisation to demonstrate as well that we are able to provide so many different services in-house.
Yeah. And with the information service, their focus has been on doing contingency plans, so like emergency plans. What would happen if they were no longer able, if the carer was no longer able to care, either because they become ill or I don't know, whatever reason, you know, people's circumstances are different. So, you know, it may be that somebody decides, actually, I've had enough of this, I can't do this anymore. So it's looking at actually what would happen if they weren't able to care. So what would happen if they were having to go into hospital, and it's making, you know, those plans early on, because we know for most carers there's nowhere actually, I've got a piece of paper, I know what to do if this happens. That's peace of mind. There's one thing less to have to worry about. So
lovely. Thank you. We'll move on to the next part of the agenda. If anybody's got anything they want to raise, just let us know. The next thing on the agenda is the Carmarthen office closure. I just wanted to highlight this because I understand that staff have been informed that the Carmarthen office, Tŷ Merthin, is going to be closed in the future. Alison Harris has notified staff. I would say several queries have been highlighted in regards to future working and the people who are affected, so the care support workers in those areas and the staff, how they will be able to attend supervisions, attend meetings, how will they be able to drop off paperwork. It seems to be quite a concern that they have. Oh, I can see that Jo has said that she's going to have to leave the meeting. Thank you, Jo. Okay. So what I would say is that the organisation and the senior management team are looking at how we are going to enable the staff affected who are in the Carmarthen, Ammanford, Gwendryth, the surrounding areas, how they are going to be able to do their job, but also without having to travel long distances to be able to drop off paperwork, perhaps pick up PPE and attend supervisions. So what I would say at the moment, if you have any queries or any concerns, please let the offices know or contact me and we will try to reassure you. We are looking at a solution that we're not going to try and make your life harder and more difficult because the office is closing. And that, you know, there's a reason why that's had to happen, but at the moment, it's Carmarthen is still operating. It is for the near future, and we will give you more information when we know it. But at the moment, we are working on how to support staff because we are aware that some staff are have highlighted some concerns with it. Is there anything anybody else wants to add with regards to the Carmarthen office? No? No hands? Okay. The next thing on the agenda, I've got to try and pronounce this correctly, so apologise if I say it wrong. Carers Trust Seroprevalence Study. I don't know whether I'm pronouncing it correct. Of domiciliary care workers. I don't know if anybody's aware of this. The Chief Medical Officer of Local Health Boards has undertaken, or is going to undertake, a seroprevalence study for COVID-19 amongst community social care providers. What they're going to be doing is looking at vulnerable people in their homes during the pandemic. The study is going to be looking at, and they're going to be contacting randomly certain social care workers to attend or to be part of this study. And what they're actually going to be doing, they're going to be taking 20% of care workers across Wales. And I do understand we have got one member of staff who has been contacted, so I think that's good for us so we can find out how it's going to work. They want to find out how far the infection has spread. And what they're going to be doing is doing a blood test to check with it. They are going to randomly select what they've said is, do not approach the local health board if you feel that you want to be part of this study. They are actually contacting you. So what they'll be doing is carrying out a blood test and analysing if there are any antibodies to COVID-19. So I think it's going to be really interesting. Is there any queries with regard to that? If you know of any staff, or if you've been approached and you feel it's not something you want to be involved in, you are able to decline the study. It's not mandatory. It's basically they've randomly selected people, and if you want to be part of it, then you can, but you don't have to if you don't feel it's something for you. But at least we know that the local health boards are trying to work towards trying to find some form of information and answers to how we get out of this pandemic, I would say. Any questions? Hopefully I've said the word correct, I'm not sure. It's a bit of a long word to say. Okay. The next thing on the agenda is office staff and contactable. And I would say even more so now with the government. The government, as from this week, have said and encouraging us now more home working again. So I think the balance is shifting again as to us doing more home working. So what I would say, the office are continuing to have a mix of working at home and working within the office. We still have the same ratios that we've had before. It's not increasing with more members of staff in the office. What we would say is that all members of staff now within the office have mobile phones. Therefore, during the working day, if you have got something particular you need to speak to, it might be for Julianne or for Angela or for Mary, or so anybody in particular, you phone and dial the number which is on the answer machine. I am aware, and you might find that Nicola and Mary might not have, because of the IT system, we can't get everybody on the number system. So whereas I say I'm number 5, there might not be enough lines to be able for Nicola and Mary, because they've come on later with the mobiles. You might have to ring another number to be able to get hold of Nicola and Mary. But what I would say, that is to use those numbers within office working hours. If you have any queries outside office hours, you ring the on-call number. You do not ring directly the member of staff, because it might not be that Julianne or Julie Davis or Angela or Kelly are actually working on call that particular time. So what I would say, please use the work office mobile numbers for staff within the office hours. Unless anybody has any other queries, that's the way we would be looking at it at the moment. That's what the on-call is for out of hours. I do feel I'm doing all the talking, unfortunately. Staff meeting and videos. Just to say, this is the 3rd staff meeting, and the last staff meeting I did check with a few members of staff to see whether they'd watched the video which is on the website. The 3 members of staff I asked hadn't watched it. They hadn't had time. What I would say to you within this meeting, I expect all staff to watch and upload, which has been uploaded on the website, the Crossroads website. You have access to it. You do know the password. We have to undertake these meetings as part of Regulation 38 under RISCA, which is information for staff. What I am going to start doing in future is highlighting what regulation meets what RISCA. So therefore, the staff are going to become more familiar. When I say Regulation 38, I mean information for staff. So under Regulation 38 with RISCA, we must, as an organisation, ensure staff are informed. And that means information and communication is happening. Therefore, in order to make sure that when I speak to the inspector, I know that you are watching those staff meetings, because he will ask, how do you know? I will be randomly phoning staff and checking that they've watched the video. And in order to do that, I will be asking them any queries or information and content from that meeting. So I then know that that staff member has watched it. So, and I will just be picking randomly staff to make sure and saying, what did you think of the what was mentioned on this agenda? How do you feel about it? I will know than if you haven't watched it, because I will be able to tell that you haven't watched it. So what I would say in future, please, I will send a message as soon as it's gone live, and I know I'm putting this on the video and you won't know this until you've watched it, but you will get a message to say that it's now live on the website. I don't know if anybody's got any questions with that. No? Okay. I feel I'm in, is it Britain's Got Talent, where all I can see are lots of screens, but no clapping. So, the next thing on the staff points is furlough, and whether there's any updates from Erica with regards to furlough. I do know that, you know, furlough is, people are on furlough for work if we are unable to cover some of the work. If they are asked to do work, then we would expect them to be able to be available for work. Furlough is if we can't cover the hours, but I don't know whether that's something Erica needs to expand or update on. So I'll have a rest and I'll pass you on to Erica.
Thanks, Karen. Right, with the furlough, as you know, we've been trying to get staff back to work as the care hours requests have been increasing, and some of the staff were able to come back as part-time, working, topping their hours up with the furlough payments, then working in the community. As it is at the moment, you're aware that all staff on furlough are required, as Karen said, to be available for work, and that you must inform the office if you're unavailable to and what the reasons are. So whether you're on taking a break, annual leave with the family, we need to know, so then that we can put in annual leave for yourself. There has been a couple of occasions where office staff have been having trouble getting some of the staff to do so, to be able to cover some calls for them. But as you were, you know, we are trying. This month now has been where we are paying 70% paid by the government at the moment. We are topping up everybody's furlough by 10% plus your national insurance and their pensions. So from next month, we've got to top up another 20%. We are trying to get all the staff back into work. So we have got, and we are going to look at, as an organisation, we have got to look at the availability of people, because people are saying, oh, they can't be available for certain calls. This, you know, to try and get everybody back to work, we have got to be, you know, more flexible with their hours. You've got to be thinking of other people as well. Everybody, you know, nobody wants to lose, you know, there's losing jobs and things in other places, but we are trying to maintain work for everybody, and we're working hard. The offices are working hard on trying to get you hours, trying to get you off the furlough system. The furlough system, as we said, is there just for to make sure that it's topping up the hours that we can't provide. But from October, that comes to an end. I'm not sure if you're aware, but the Chancellor is holding a meeting today at lunchtime. So he is going to do the next steps because of the furlough is finishing. So as soon as we know anything, we will let you know. We will inform you. We know that the Welsh Government have announced that staff having to self-isolate for the ones on low income, that they can have this money available for them. I'm trying to find out the clarification of what it means on low income. So this is another one that I've got the area I have to look into, and as soon as I can address it, you will be informed. Also, there's what's the other one? The government, the £500 special payment has been put into your pays this month. But this is not tax-free, as you will have noticed from your pay slips. You've had to pay tax on it. There are a few who have opted for the £100, which will be paid, which has been paid this month, plus over the next 4 months as well, as they wanted. So to go back, it's the furlough. Please, you know, once the office staff bring you up, and there's hours they're available, because I'm aware that some of the office staff have gone out to do calls because they haven't had cover, but we have got people on furlough, which really is not the correct thing to do. So as soon as we've got any more information, we will let you know regarding the furlough, the payments, as I said, whatever the Chancellor says this afternoon, there will be an announcement, we will let you know. But until the end of October, we know that the furlough is in place till then. So it's after then that we have then got to make sure that everything is in line, that everybody has got work to come back to be able to work to come back to. The hours at the moment are increasing in both areas. And the ones that were shielding, there was a lot of people with us shielding, and they have come back and they work in part-time as well at the moment since August. We have still got, though, around nearly between all areas of 50 staff while doing part-time and part-time furlough. But we are hoping that, you know, with the increase in hours, that there'll be a lot more coming off the furlough within the next couple of weeks. With the furlough staff as well, as was before, there was a week you have accrued another week's annual leave, and this will be put into your pay next month, because it's we've had one back in July, and there's another one due now again. There's another week's annual leave accrued. So at the moment, as I said, it's a case I am waiting to hear back. You know, as soon as I've got all the information from the Chancellor today, from the Welsh Government regarding the self-isolation and how we go from here, we will inform the staff appropriately. So I'm sorry, that's the only updates I've got there on the furlough.
That's quite clear, and as Erica, just to reiterate what Erica has said, if you've got office staff that are covering calls because the care support workers are not able to do the calls, and they are on furlough, and we've got still staff on furlough, that is not a good business sense. The fact that we're actually then having office staff doing the calls, that should not happen. If that happens, that means that nobody's on furlough, not that we've got staff on furlough. I am aware some staff might be due to health reasons. However, that doesn't seem to be the case, and some staff have declined hours, declined calls, when they're actually contracted to do it as well. So that is a major concern for us as an organisation if they are doing that. I don't know whether or not the office staff need to comment on that or wish to comment with regards what is happening at the moment. No? Have we covered?
But it is one that, as an organisation, like the senior management team are looking into, because of all the availability for all the staff working to make sure that we can bring everybody back and that everybody is potentially, you know, got to work the care hours. Sorry, Lynn, I can see your hands up.
Oh.
Getting stepped in there.
Good morning. Yeah, I was just thinking about looking at staff contracts then, isn't it?
Yeah.
If staff are not coming back. Because if staff are not, if we can't, we need to be having more staff on lesser contracts, if that's the case.
Yeah, it is one that we are having. It is on the agenda with the senior management team then, that we have got to look at a whole, for the organisation. We want to make sure that everybody's back and working. Yeah. You know, and that to be fair for everybody. Yeah. Because we have got some, you know, but. Some people doing a lot of hours, everything to cover for other people. So, other people, you know, yeah. And
that's it. Then they're going to be worn out then, because they're covering for other people. Yeah. Why, you know, are always off or can't come back for various reasons. We do have flexible working hours, so there are hours that will suit people. So I think we need to be looking at that.
Yeah, I agree with you, Lynn. We are looking, and Eric is correct, we are looking at it in the senior management team. When Alison returns from leave, we will be looking at contracts, because again, if you have a high contract but you're not able to meet the hours for whatever reasons you are stating you cannot fulfill, then that is a concern for us, that really you are not meeting your contracted hours that we have given you. So we have to look at contracts in whole. Even though we're a charity, we are a business to be able to survive, and what we won't want to do is turn around and say, well, actually Crossroads isn't able to continue because we're trying to meet all needs, which actually we're not doing. I can see Julie Davis, your hands up.
Yeah, I want to jump in a bit about the contracts as well. Some staff think if they've got a 35-hour contract, they're not going to work any more than 35 hours. I think I spoke to Eric about this yesterday, and that's not the case. They've got to work slightly more than 35-hour contracts.
They've got to be available. What it is the availability. Availability for whatever contract you're on. That is only 75% of your availability. So once you're working the 28 hours, you've got to be available for about 35 hours just to make sure that your contract is viable. Because if you lose, as we know, clients can cancel and things. So to make sure that your 28 is in, you have got to have the availability in there so that we can come back and say, right, cover your calls. Because we don't know that some people saying that they've got a call covered, they have it cancelled, and then when we give them a different call or that they can't do it, well, that is, as I said, you were available for that for a particular call, so you've got to be available to cover those hours as well. So, it is a bit of a juggling act at the moment, but it is one that we are going through to try and sort out.
And again, if they're planning on the ones who are on furlough, planning some trip or something on a particular day, you need to be informing us that you are not available, because we have put in work in for you, and then you turn around and say you're going away. So that we need to know.
Yeah, that is one I have put down, that they've got to inform the office if you're unavailable and your reason for it, because then you have got your annual leave. They have been off now for 6 months. They have annual leave. That's why I'm putting the 5 days annual leave again that they've accumulated to be covering. So it's a case of, right, we need to know. And especially the same with people going away, it's regarding self-isolation coming back. Because if we're not aware, as we said before, if they come back, then they're making themselves unavailable. So then there would be no sick pay or furlough pay paid for them, because they've made themselves unavailable. Every staff on furlough at this moment has got to be available for work, unless there is a reason, as I said, a medical reason at the moment. But, and as I said, 5 weeks we've got to the end of the furlough, and in that time we've got to make sure that everybody's back working. The hours are increasing. We can't refuse it. Everything that comes through at the moment, we're not refusing any work. And not refusing any work is, it means, good that we can sustain as an organisation, but we have got to have the staff as well to play ball with us.
And we as an organisation, we can't, the local authority can't say, can you take on this package? And we say, well, actually, no, we haven't got staff, when we've got staff on furlough. Yeah, does not make sense.
We are flexible working, but there's only a limited amount of flexibility we can do. If Mrs. Jones wants a call till 5 o'clock, we've got to provide that call till 5 o'clock. We can't just stop at 3 o'clock. We've got to provide these calls.
Yeah. So I think that's been quite clear that we are looking at it. There will be staff will, as soon as we have had a meeting, and it will be brought back to the staff so they are aware exactly how we are going along with
I think it's important to look at these contracts and to review them all. With the staff who are generally on lower contracts, are working far more hours, and that's due to their availability. And then we've got the staff on the higher contracts whose availability is absolutely appalling.
Yeah.
So that needs to be looked at.
We will endeavour to look at it, Julie.
Yeah. Thank you.
If I move on, 10:20. Just, it was mentioned, it's not on the agenda. Joe did highlight it before we started recording, with regards to flu jabs for staff. Anyone who has a health or medical condition and you were already entitled to have a flu jab, there seems to be different avenues now. Rather than just going to your surgery, you can also go to pharmacies. I understand that I think Boots, the local chemist, they're sending out letters stating that people can go to them, book an appointment and have a free flu jab with the pharmacy, and what they do then is notify the surgery. But I would also say that with regards health staff, you're encouraged, when I say encouraged, strongly encouraged, to get the flu vaccination. If you're looking after a friend or relative, you are entitled to look at to have a flu jab. We will look into it further if you need us to, but what we would be saying, anybody who has a medical condition themselves, or you're looking after somebody, a friend or relative who has a medical condition, please ensure you're booking yourself for a flu jab, whether that's with your local surgery or the pharmacies. And what I would say, do it sooner rather than later, because even though now they're saying the flu jabs are available, I should imagine that the waiting list and the booking system is going to get quite full quite quickly. So what I would say is, please put flu jab on your list of things to do. Is there anything anybody needs to mention about flu jabs? No? So that was something that's been raised. The next thing on the agenda is just to give you a little bit of an update with regards to Ceredigion. And because we're usually more Carmarthenshire focused, just for Sarah to just give a little Ceredigion update if there's anything we need to be aware of as well.
Yeah, well, we've in Ceredigion, as with Carmarthen and Llanelli, we're finding that we're getting an increase in referrals now. This is via Gofalwyr Ceredigion, which is our referral service. We are getting huge amounts, and even with the framework, which is the services that are commissioned via the council directly to us, we're now moving away, as I've discussed before, from the 3-hour services. So we are getting people that are wanting full days, they're wanting lunchtime calls for socialisation. So we're getting a lot of differences in services now. We're getting some weekend services. So there's a lot of change in the way that the services are coming through, whereas it was traditionally 3 hours, you'd move on to do another 3-hour call in a day. So, you know, availability with staff, you know, one client can take up a full day now rather than, you know, having to move on to a couple of clients. So that's the difference in the services. And we're trying to be as flexible and to suit people's needs as much as possible. So, you know, people will start wanting early evening calls. And, you know, we have even been asked for overnight calls as well. So availability, if any staff have any extra availability, if you can come to me and let me know. We've got a couple of new staff that will be starting next month. One staff member in the north and one will be working in the north and the south. So I'll be introducing those to you in due course. We've also been asked to participate in a pilot called Ask Us About Dementia. I'll share the information throughout the organisation. It's a pilot scheme that the Social Care Wales and the local health board are running. How it works is that people can book onto appointments. So if you're working with anybody that's supporting someone with dementia, or you know of a family member that needs specific advice on dementia, so that could be dietary needs, sleep patterns, anything specific like that, they can book onto these appointments. There's currently 2 a week at the moment running, and they can speak to a medical professional. So there's a few medical professionals involved in the pilot. So there are dietitians, there are specialist dementia nurses, there are physiotherapists. So if there are people that are, you know, having problem with manual handling with somebody with dementia, so they can book onto these. They can have up to 20-minute consultation with a professional via Zoom. They can do it via phone calls, and so it's tailored information. So they're running it for the next 6 weeks. They're hoping to continue that. So yeah, so you know, if you know of anybody, you know, it's a great pilot. You know, we'd like to be involved and try and get the numbers up. So because they'll be putting more appointments on as the more people that we get involved. So I'll send all the information around to everybody. So, but yeah, that's me for now. Thank you.
Lovely, thanks Sarah. Sorry. Okay, we got hailstones in where I am. Okay, the next on the agenda is service delivery and quality care, which I don't know whether Erica has got anything that she wants to mention with finance. I know you have touched on finance with regards to the payments. Is there anything that you need to highlight with regards to the finance side of it?
No, it's just the same as always, Karen, and just making sure that the staff do add their mileage to the BIAP, and that they know where it is. It's on the notes section showing the client visit, and that to ensure that they bring in back the client sheets. Any issues that there are no client sheets in the clients' homes, please to inform the officers. I think it is one that will be having a discussion with the office staff so that they can send out all client sheets to every client again, because I've had a couple of staff ringing me up and saying that there was no sheets in there. So I think perhaps we need to just go and send out sheets to every client just to make sure they're in their homes ready.
Okay.
So no, that's it.
Okay, thank you, Erica. Just to say, just some feedback. It wasn't mentioned in the last meeting we had about homecare.co.uk. We did have the last feedback we had was 11th of June, and we had 5 out of 5. And I'm just going to read it quickly, saying, because it is relative to the COVID period. I'm a full-time carer, and my husband and I have been shielding since March. My husband has complex health issues. His carer is very His care is very demanding and time-consuming. I have been very fortunate to have support from Crossroads. Since March, a member of staff has been doing my weekly shopping. This service has been invaluable. They are such a caring, considerate person and so professional. Without this support, I would think I would have folded. God bless them all. Thank you. So I think that's a really nice comment that they've mentioned on the website. And I think it's really important that we do give the staff feedback if they're not going on the site themselves, what people are saying. The next comment is about a quality assurance review. So what I would say, under Regulation 73, so I'm really going to get people to know what regulation it is. Under Regulation 73, we have a duty to carry out quality assurance reviews, which is different to normal annual reviews, and the 3-month reviews. The RI, which is our responsible individual, Helen Nichols, she's the chair and the trustee. Alison and I are completing quality assurance reviews. I'm looking at the initial 3-month reviews, and Helen is looking at randomly selecting some of the clients. We're doing the calls via the telephone because of COVID, and it's not ideal, but it's safer to do so. Just to say, on the 9 I've done over the last 3 days, the feedback I received was very, very positive. And I cannot stress enough how the support that the carers and clients are receiving is so valuable at this moment in time. They have been stating very positive things, the compliments about the staff and the service they're receiving was exceptional. What I would, and that information then is being recorded, and then that information is being documented for our inspector and anybody else who comes to audit us. So compliments will continue to record via feedback received and other professionals, but what I would say is that this is going to be an ongoing thing, and although I've done the 3 months, I'll be then looking at the next lot, which will be 6 months in October, November. But this is on top of the office continuing to do reviews as well. These are quality assurance reviews that we, as an organisation, have to be doing. But again, thank you all for all the work you are doing, because the carers could not fault the service they were receiving from Crossroads, so thank you. The next thing to say, there's moving on, there's a health and safety meeting that has been planned to cover recording and reporting, and it's due, I understand, on the 6th of October, where there will be a section of staff. There will be some trustees, office staff, senior management team, and I understand some nominees from care support workers will also be attending. And what we need to be doing is looking at any particular accident incident reports, and also the safety especially with COVID at the moment, COVID-19, the safety of the staff. Now we're following full safety practices really and guidance. So that's happening on the 6th of October. Excuse me. We are getting to nearly the end of the agenda. The next thing to state is August policies that come through and they're reviewed and have to be implemented by November. Lauren, the HR administrator, will be putting them on the website shortly after a committee meeting that's being held next Tuesday, the 29th of September. The health and safety is also a review policy, an FO1. You've got health and safety documents. It's quite small policies this occasion. Mobility assistance, lone working and positive behaviour. They are the 5 policies which are relevant for staff. What I would say is that there are more policies, but they're more relevant for the trustees and for office management staff. But they are the 5 relevant for yourselves to ensure that you are reading and understanding those policies. It's very important that you are reading them as part of your role as a care support worker. Moving on to post-registration training learning with Social Care Wales, I will mention it every time. Please ensure that you are recording your learning hours. Most staff are now into their 2nd year of registration. Therefore, if you've got to do, and my maths, I can work out the maths on this. If you're doing 90 hours in 3 years, if you're into your 2nd year, you should be now well over. If your 1st year you've done 30, if you're into your 2nd year, you should be 35, 40, 50, 40 to 50 hours. If you know you're not 50 hours, 40, 50 hours, you need to be raising this with the person who you line manage, is line managing you, because you have to get those hours. My concern is when you're into your 3rd year, you do not turn around and say, oh, I think I've only done 5 hours. You have to be doing the hours of learning. I understand that both offices are providing and sending you e-learning. Please ensure that you're doing it and you're recording it. It's so important. Otherwise, by the end of the 3rd year, you're going to struggle to re-register with Social Care Wales. We will not be able to give you the hours of work, which means that's going to impact your family life and working hours and money. So please, don't just think, oh no, I haven't done the hours. Please ensure that you are putting the hours on your, and if you're struggling, let us know and we can support you in that. Point 6 is any other business.
Karen, Lynn's got a hand up and Julie.
Oh, sorry, Lynn.
Yeah, just to say with the e-learning, there are free ones every month. I don't know if all staff are aware of this, but I think it's not every month, every sort of 2 or 3 months maybe, there's a free one which they can do. Right, okay. So for them to do that, they can add that to their hours and also then just let us know because I don't get a certificate for that. Right, okay. So any ones that they do additionally, if you haven't put them on, they have to let you know. Yeah, they'll get an email from Social Care TV to say that there is a free course that they can do. Does the certificate goes directly to them then? Does it not? Get the certificate. Right, okay. Yeah, but they can forward it to myself or Julie or Kelly or.
Yeah, when it comes in every month, I send it out to everybody. When I get it, I send it out to everybody to make sure they get one. And some staff do it, and then some staff don't. Yeah, it's an opportunity for an extra hour every month. So throughout the year, you'll have 12 hours to use. So if there's an opportunity you're going to miss if you don't do it, and you've got to do it by that deadline date, otherwise it'll expire. Yeah, there is a date. Yeah.
Thank you, and I think that's really important because if people are worried that they're not going to get their learning hours in, that we're already able to provide them, as you said, with 12 hours, which if you only need to do 30 in a year, that's quite quick. You can get your hours in. Yeah. So we can't stress this enough because it's so important to get your learning hours in. And nearly all staff are registered now. I think we've got 135 members of staff who are registered with Social Care Wales. There are a few that have to complete, but we're talking 1 or 2 members of staff. With the any other business, I did, and I am sending out the agenda on time to make sure that staff can look at it and say, right, okay, I've got a query, I've got a question, I'll ask the office or I'll ask Karen. I have to say, I was very surprised. We've only had one query. We're going through a pandemic. We're going through potential Carmarthen closure. There's lots of things changing, and we had one query. Out what the query was, and the query had come through was, should we have thermometers to check the client's temperature on arrival at their home? My answer to this would be, it's not appropriate for a carer to go around with a thermometer to perhaps check a client's temperature, because if a client or carer is displaying any symptoms, we would expect them to inform the office that they have potential symptoms. Therefore, we would then cancel that call. I know it's very hard to do so, but and also staff are informed with regards PPE. We've mentioned it in the last staff meeting. You are all provided with PPE. You're all expected that any call you go into, you are risk assessing that environment at that point in time. I know that the office and the care coordinators, care managers would have done a risk assessment. However, things are constantly changing at this moment in time. So if you are going into a call and you're not, if it's replacement care, you're not able to self distance, you should be wearing some form of PPE, a mask. However, if you're doing personal care, however, you have to use your own judgment and risk assess any care call you are going into. Therefore, I mean, I would say a thermometer, I don't know how anybody else within the office would say, but I would say if we were doing a thermometer scan on every carer, it would be we would then run away, turn around from the care call.
Yeah, no.
I don't know how anybody else would, but that's my initial reaction to that. We would not be testing clients or carers with thermometers before we go into the call.
No, I agree.
Yeah, okay. Yeah. So I am surprised because there was only one query. And what I would say to that is, if you were assuming, as opposed to asking questions, you're going to get the wrong conclusion to a query. So if you're making up your own mind as to what you're worried about, it potentially is going to be the wrong result. So what I would say is, if you've got any queries or any questions, you need to use this platform to ask us. Otherwise, you're going to add additional pressure and anxiety to yourself. So please use this. I know it's difficult, but please use this option to ask questions, because you might have a question that everybody else is thinking but doesn't want to ask it. Please ask the questions, because I think one question in every 8 weeks is not really a lot. People are perhaps making their own minds up to certain scenarios. The other thing is, point 7, previous meetings, topics discussed. I want to put them on to just make people aware there are no current updates in regards to the Crossroads name change or the day services, which are remaining closed. What I will do is keep them on the agenda, because otherwise you will wonder what happened to them. What is the update with the day services? So at the moment there is no update with regards to the Crossroads name change or the day services. They are remaining closed, and the name change is at the moment still going through that process. I've covered everything I need to for the meeting, the agenda items. So I'm going to open it up to people who are attending the meeting now. If there's anything that perhaps that didn't have chance to go onto the agenda that we haven't already covered, you feel you want to discuss now and raise with the staff. So if there are anything within this meeting now that you feel you need to cover before we come to a close. I can see Julie's hand.
Yeah, back to PPE. Both offices have got ample supplies. I would say if they're in doubt of going to any clients' homes and they feel that they need to wear a mask, wear one.
Thanks, Julie.
Gone.
Bye. Anybody else? Thank you. Is there no, the next, just to say the next, oh sorry, have you got your hand up, Sarah? You're on mute.
You're on mute, Sarah.
I'm on mute, sorry. For staff in Ceredigion, we also have the PPE, so if you need to organise any to be collected, then just let me know, because I'm not in the office all of the time. So if you need any PPE, just let me know and we'll get it out to you.
And I think going back to the evaluations I did with the quality assurance reviews, I did on one of the questions ask the carers if they had any concerns with regards COVID and PPE, because I know that in the media and very much in the news it's always PPE is running low, how are care companies managing. I reassured the 9 people I spoke to that we have plenty of PPE and not to worry, that the staff are trained. They have full guidance on how to use the PPE and when to use it. So that was just something that I wish to raise with the carers and the clients when I was doing the quality assurance calls. Is there any other questions or anything else that anybody wants to raise? No?
So all I want to say, Karen, is that as soon as any information is relevant to the furlough and for the working environment is released, we make sure that we pass it on to all the staff.
Lovely, thank you. I think I'll just put the meeting to a close now. The next one, I would assume, with the way the current climate is going, it will again be via a video and it will be on November. I will set the date shortly, but it's in November, and again, it unfortunately be through a video link. If everybody else has covered everything they need to, we are now 10:43 and we've been approximately an hour covering the staff meeting. Thank you all for attending. So I'll say thank you all and keep yourself safe. I know everybody's probably fed up with that term, but keep yourself safe. Okay, thank you. I will now stop recording. Try to anyway. Bye.
Ta-ra.
Bye.